for coming to the 9th edition of the Neurointerventional Master Course. First of all, I want to say thank you to the faculty. We have professors coming from the United States, from Finland, China, Turkey, Peru, Denmark, Hungary, France, the Netherlands, Kazakhstan, Italy, Portugal, and Japan. It's people coming from everywhere on the world. Some people, they have make 20 and 25 hours to come to Madrid to meet this Congress, to meet my father, and I am really proud. Thank you very much to the representation of the city government. Thank you. And thank you very much also for the support of the Hospital Clínico San Carlos. I give the word to Mr. Julio.
So, good morning and thank you very much, Willis. Good afternoon. Deputy Minister of Health, Doña Ana Dávila Ponce de León y Municio, Don José Soto, Chief Executive Officer of Hospital Clínico San Carlos, Luis Lopez Ibor, he's the Chief of the Interventional Radiology Unit at Hospital Clínico San Carlos, and to all of you, thank you very much. And on behalf of the Chief Executive Officer, Don José Soto, and the rest of the hospital, I would like to say thank you for donating your time and your knowledge to improve patient care. That's our priority as a hospital. It is really a privilege and an honor to have you here once again. This is the 9th edition of this interventional radiology master course. And it's absolutely delightful that you come here to spend your time trying to improve patient care. I would like to thank, of course, all the professors that have traveled from all around the world to Madrid to meet here and to present and discuss cases and situations and scientific knowledge. And of course, I would like to say thank you to the 3 people who work at Hospital Clínico San Carlos very hard as pioneers of interventional radiology, neurointerventional radiology in Madrid, but not only in Madrid. First of all, Luis López Ibor. It's a privilege to have him at Hospital Clínico San Carlos on my capacity as Chief Medical Officer. I'm really happy and I'm really honored to have you among our faculty. And of course, 2 people who work hard to make this possible also, and who provide excellent care to all our patients, Dr. Santiago Rosati and Dr. Manuel Moreu. So, in summary, thank you very much. Thank you very much for spending your time with us. And from Hospital Clínico San Carlos and all the professionals that work there, and our patients primarily, thank you very much.
Now I give the word to the representation of the city government, Ms. Ana Dávila Ponce de León Municio.
Good afternoon, dear Javier Lopez Ibor, dear Dr. Mayol, dear José Soto, and also dear Professor Luis Lopez Ibor, Director of this master course and Director of the Neurovascular Interventional Unit of the Clínico San Carlos Hospital, dear professors and professionals attending this event, welcome to Madrid, and thank you for your presence. It's an honor for me to greet you in this 9th master course on neurointervention, a new edition of this highly specialized scientific event in which the latest innovation in interventional neuroradiology are going to be presented. Madrid Healthcare System proudly hosts this international meeting that gathers renowned, prestigious speakers, among which some of the greatest experts in interventional radiology worldwide can be found. Taking this into account, allow me first of all to congratulate Professor Luis Lopez Ibor for organizing this main course, which has become a benchmark to stay up to date with these complex techniques due to the presence of many prestigious experts. Congratulations for this new edition of the master course. This master course gains full meaning when becoming, once again, a scientific forum to promote and share actively with major international experts the most advanced techniques used nowadays in their field. To that end, during these 2 days, an interesting scientific program about treatment of aneurysms, vascular malformations in brain and marrow, among their topics of interest, is going to be developed, expecting it to be highly beneficial. Neurovascular malformations, just one example of a field addressed in this meeting, and in particular strokes, are a severe and growing health problem that is already one of the main causes of mortality and severe disability, both physical and mental, therefore having a big effect on healthcare and social protection systems. To address these conditions, interventional radiology is positioned as the first choice alternative since it's allowed for a high therapeutic performance in the ischemic and hemorrhagic neurovascular pathology, which are urgent indicators of high priority. This success in its professional fields comes from continuous innovation, such as advances in imaging, technological development, and use materials. Together with the determinations of the professionals, we will continue advancing, training, and perfecting the techniques for the benefit of the affected patients. In this sense, continuous training is essential when training for the excellence in neurointervention. A good proof is the leadership taken by the unit of Professor Lopez Ibor in the preparation of professionals. The values of professionals who share assistance, teaching, and research are the cornerstone of the excellent national healthcare systems that we have in Spain and especially in the Community of Madrid. A good example of high specialization in the treatment is the treatment of stroke. The stroke code and the articulation of responses throughout the different hospitals units and the emergency services is an achievement of the Madrid healthcare system, thanks to the high commitment and involvement degree of professionals. In this successful coverage to treat these ailments, it is of the utmost important the role of service such as neurovascular interventional unit of the clinical hospital led by Professor Lopez Ibor, which together with other existing institutions in the Community of Madrid facilitates access to neurointervention 24 hours a day, 375 days a year. However, our goal is the continuous improvement and the incorporation of new technologies and procedures that prove to be more effective, especially the incorporation of minimally invasive techniques. For this reason, we continue working on this field with the active participation of professionals who are highly devoted and involved in this type of service. In addition, we want to strengthen the concept of humanization of healthcare, since we consider that this is a basic element for the quality of healthcare in situations of vulnerability. And we know that if it's possible, it's more necessary. Professors, doctors, dear professionals, Community of Madrid regional government is firmly committed to offer an excellent healthcare system in which teaching, innovation, and research are his fundamental pillars. Events like this master course, contribute to further advance towards the healthcare systems we want: cutting edge, efficient, humanized, and with the highest quality. I hope this meeting fulfills the expectations and also leaves you time to enjoy the cultural, historical, and tourist attractions of Madrid and our region. Thank you very much.